The class of PARP inhibitors have the consistent toxicity of GI and fatigue. What I mean by the GI is nausea. Very rarely patients vomit. So it's very important when you send these patients home with a prescription that you follow up, make sure that they're tolerating the medication, and that they go home with prescriptions for antiemetics. With regards to the fatigue, our options of treatment are not as easily overcome, or the toxicity is not as easily overcome. Depending on the degree of toxicity they have, may require dose interruption or reduction. I often will be more apt to dose reduce with fatigue unless it's quite profound. The PARP inhibitors also do have hematologic toxicity, more so in some of them. Rucaparib, you will see anemia. Usually the treatment for this will be transfusion, depending on their symptoms. But it is reasonable to interrupt, see how they respond, and then potentially dose reduce. If I think that the anemia is the result of the treatment, I will be more so to dose reduce in these patients. The other toxicity which we see is common but not clinically significant are the LFT abnormalities. What's really interesting about these drugs, though we see the LFTs go up in the first cycle, they will return down to normal within the next 1 or 2 cycles. But it does not seem to have any clinically significant outcomes. And they do not have liver dysfunction. It's just a finding that we see, a non-clinically significant finding. We also see elevation of creatinines. This again appears to be a class effect, though better described with rucaparib. Often we'll see a slight increase in the creatinine. Again, does not seem to be clinically significant. Obviously, if you see a marked increase in the creatinine, that requires a further clinical evaluation. We are very excited about the options of PARP inhibitors in platinum-sensitive maintenance. We have these drugs available to us. Clearly need to consider them in the maintenance setting. We need to make a determination about using them versus other options like cytotoxic, observation, or BEV. When we make the choice to proceed with PARP maintenance, we really need to educate patients with regards to the potential toxicities, fatigue, GI, other toxicities. It's very important when we look at these options that these patients are prepared to manage these toxicities at home, and we can assist them in that.